Welcome to the Floyd Memorial Library podcast, where we sit down with the people who give shape, texture, and voice to life on the North Fork of Long Island. Some are rooted here by generations, others arrived by chance or choice, but all carry with them a piece of the story. We talk about what's changing, what's worth holding on to, and the currents of history, both quiet and loud, that run through this place. I'm your host, Christopher Bianchi. For episode 195, we sit down with Dr. Alison Madden, Chief Medical Officer at Stony Brook, Eastern Long Island Hospital, a board-certified OB-GYN with extensive experience in both large medical centers and community hospitals. Dr. Madden brings a deep commitment to advancing patient care on the North Fork. In our conversation, she shares her path into medicine, what drew her to Stony Brook, Eastern Long Island Hospital, and how her dual role as physician and leader helps bridge clinical care with hospital strategy. We also talk about her priorities as Chief Medical Officer, the hospital's new initiatives, including its work towards becoming a primary stroke center, and the upcoming Mattituck practice where she'll begin seeing patients. Dr. Madden offers insight into the evolving landscape of healthcare out here, the importance of community partnership, and her vision for the hospital's future. So I hope you enjoy episode 195 with Dr. Alison Madden. This episode was recorded August 18th, 2025. Thank you so much for coming on the Floyd Memorial Library podcast today. It's really great to have you on today.
Oh, thank you for inviting me. I'm excited to be here and part of Greenport.
Definitely. And so in the beginning, I'd like to start off if you can tell us a little bit about your background and what inspired you to pursue a career in medicine.
Yeah. So I grew up in New York City and I liked museums. I actually was a librarian in college and in med school. I liked the ballet, the arts. And when I went to college, I studied art and art history at Barnard College. Nothing to do with medicine. I did work in a clinic and an office and wasn't really finding a career in that field that spoke to me. I like using my hands. I like helping people. So I was looking into massage therapy or becoming a midwife, and then started doing courses after college at Hunter College and found out about a program where you could get into medical school early after doing research. So I did research in HIV. It was in the 80s when AIDS was really claiming lives all around me. I lived in the West Village then. And so did that and was able to get into med school early and went from there. Loved OB-GYN. The miracle of childbirth was incredible. But I also just like working with people and working with my hands and found it very rewarding. No one else in my family was a physician or anything medical, so it was just something I found kind of by chance.
Yes. And so from there we might be jumping a bit, but what drew you to join Stony Brook, Eastern Long Island Hospital?
So I was looking to come back. My twin sister is still in New York City. She has a son who has a progressive neurologic disease and needs more help. He's the same age as my son, 22. Wheelchair bound, no longer verbal, needs really 24/7 care. And so I was looking around this area. I came here from New Hampshire. And when I come from New Hampshire, I take the ferry from New London and had driven through Greenport many times. And so Paul Connor, my boss, always likes to say that Eastern Long Island Hospital is the last hospital in Long Island for people. For me, it was the first hospital that I saw coming this direction. And so I was interviewing at different places in New Jersey, New York, Long Island. And when this job came up, I was like, oh, I know that town. It's so beautiful. And then the day I came to interview here, the power was out in town. So I came into a dark lobby in a dark hospital. Someone had unfortunately hit a utility pole and become injured. And I met with the leadership team in the dark in Mr. Connor's office, and we walked around the hospital. Everyone was so friendly and happy, which usually when stuff like the power goes out, people are stressed and they're anxious, but they were treating each other well. They were smiling, laughing, helping. And when we sat down to wrap up the interview, the power went on and the lights came on. We were all like cheering. And I felt like this was the place. I went to meet with the Stony Brook executives, and they were wonderful. I think having Bill Wertheim be the head of the Stony Brook institution as a physician who really cares about patient care, still practices, that's not something you see every day. Having a world-class institution like Stony Brook that takes our transfers, that works with us, I really liked, but I love community medicine. I liked the size of the hospital, the feeling of being a community, both in my professional career and my personal career. My parents were in Nantucket at the end of their life. My mom spent the last 10 years of her life there getting care at their local hospital, and the people treated her so well. And people really treat each other like family in a hospital like this. So it was my first choice.
Yes. And like you said, you've worked in both large medical centers and community hospitals, but are there any other unique opportunities you see for the hospital here?
So many unique opportunities. I think having that collaboration with Stony Brook gives us the ability to really elevate the care and make transfers seamless, either by helicopter or ambulance, depending on the situation. What I'd like is to be able to bring more services here and expand access and services. Having an ER doc is pretty incredible, too. I have never seen a hospital with a doc. One of my colleagues up in New Hampshire, his father was on a boat around here and had suffered a heart attack and was brought to our hospital and saved and doing well, and he spoke so highly of it. I think there's a lot of opportunities here to serve the community.
And now in your new role, for those who may not be familiar, what does a chief medical officer do day to day?
Well, it's a lot of meetings. It's a lot of other duties as required. You know how they have that in job descriptions? That's a lot of what a chief medical officer does. I work with the staff, with the physicians. I work with Stony Brook. We make sure that we're providing the best quality care we can, see what needs aren't being met, how we can increase access, lots of different things that are really fun to do.
Yes. And what are some of your top priorities for your first year at Stony Brook Eastern Long Island Hospital?
Well, first, I want to understand the community and understand the staff needs in the hospital, the physician needs, the collaboration with Stony Brook, how to make that work for everyone. And I'd love to improve access. I'd love to be able to increase access for the patients in this community, for all services that would be appropriate at a community hospital, and remove any barriers for them to getting the best care they can locally. And when that's not possible, making sure that the transition to Stony Brook University Hospital is seamless and as painless as possible.
Yes. And how do you plan to strengthen the hospital's connection with the community and local providers?
I think talks like this, having people do educational seminars. I got the chance to go to Peconic Landing to meet with the residents there and the community there. I think really listening to each other to see what services are needed, where can we help, how can we grow.
Yes. And so the hospital has been making exciting advancements, including work towards becoming a primary stroke center. Why is that so important for our community?
With a condition like stroke, every minute counts. So having a local hospital that can provide care in minutes makes every difference for someone's recovery or even survival in some cases. Our community is one of the older communities, actually the oldest community in New York State. The age per capita is higher here than elsewhere in the state. And stroke definitely involves older patients, although we're also seeing it in younger patients, even in their 30s, 40s that have stroke. It's very important that the community knows how to recognize a stroke and that they go to the closest hospital by EMS to get care.
Yes. And like you mentioned, it is a new thing in terms of younger people getting it, but are there people studying, figuring out why that might be happening in younger patients?
We saw it with COVID. The initial strain of COVID did lead towards more strokes in patients, although it's happening even after COVID and not related. It's not entirely clear. We are seeing some cancers in younger patients, strokes in younger patients, and it's really important for everyone in the community to be aware of it. There's a mnemonic called Be Fast, which helps people recognize the signs and symptoms of a stroke. It stands for, the B is for balance, so if someone's losing their balance. The I is for vision, so if they have visual changes. The FA is for face, so if one part of their face seems to be drooping. And the S is for speech, so if they're slurring their speech. And then the T is for time. That's not a symptom, but that's something that's critical to remember. If you are worried that you or your loved one might be suffering from a stroke, call 911. Don't drive. Don't drive far away. Go to the closest hospital that can provide treatment.
And even looking beyond the stroke center, what other new or growing services should residents be aware of?
So starting soon, we're going to have an emergency room fast track service. So if you come in with a more minor ailment, like you need stitches or something that isn't likely to take a long time, we have a separate area where patients will be fast tracked for services. And that also gives a little bit more room for the patients needing longer services or more acute care. So trying to streamline things. Our ER has excellent waiting times, but no one wants to wait in an ER any longer than they have to. And dividing the cases that come in into fast track and the main ER will help with that. And we're also expanding our primary care base and our specialty care. So we have a new primary care and also addiction-trained physician who's joining us, a urologist who's joining us, and I'm a gynecologist and will be starting care as well.
Yes.
One more thing I forgot to mention is we are starting a tele-ICU probably early in 2026, which will help us provide 24/7 physician-led intensive care services that will be very beneficial for our stroke patients that we're keeping and any other patient in the ICU. This is technology where a physician can see the patient. They can even like zoom in on eye pupil diameter. Like it's a very advanced technology and give treatment recommendations to the team that's there. So that will be wonderful.
Yes. And as a OB-GYN, you'll soon be seeing patients in Mattituck. Can you tell us more about this new practice?
So I'll be joining a multi-specialty team that's out there right now, including primary care, orthopedics, spine and sports medicine, pulmonary and general surgery. I'll be providing comprehensive GYN care for everyone, and I plan to provide routine exams, reproductive care such as birth control, with things like Nexplanon and IUD that the family practice physician doesn't do, help with menstrual problems, perform colposcopies or biopsies as needed, and then menopausal care and concerns that people have, and whatever else is needed.
And for women who may not have a regular OB-GYN or haven't had a recent checkup, what would you say to encourage them to make an appointment?
Oh, come get checked out. None of us like to go to the doctor, especially the OB-GYN, but it is really important for your health. Sometimes people have past trauma or worries about confidentiality or judgment, and I really think it's important to learn if people have specific concerns and to treat everyone as to the best of my ability and help if there's perhaps past trauma or they've had a bad experience in the past with gynecologist. Gynecology is often pretty confidential, and in a small community, sometimes people fear that what they tell me might be exposed or somehow other people would know, and I'm very sensitive to that. LGBTQIA patients are sometimes worried about feeling judged or not addressed by their pronouns as they want to be, and it's very important to me that I treat everyone with respect and do the best I can to help.
Yes. And how does your dual role as CMO and practicing physician help bridge patient care with hospital leadership?
I think as a practicing physician, and I practiced full scope OB-GYN for 20 plus years, it's very important to bring those experiences to the table when we're making decisions. OB-GYN is kind of a unique field in that there's a little bit of primary care, there's surgery, there's obstetrics, lots of different areas, and I obviously don't know everything, so I work with the other providers, physicians, APPs, to find out what needs and concerns they have. And it's really a collaborative team effort with nursing, with our finance specialists, with our leadership, both here and at Stony Brook, to try as a team to provide the best care to the patient.
Mm-hmm. And for the community, what do you see as the most pressing or health challenges for the North Fork and Shelter Island?
I think access to care is a problem. Access to specialty care can be a problem. Recruiting for the hospital. The hospital is the largest employer here, provides a lot of financial and employment benefit to the community, but getting people here is hard. Part of that is because of housing. It's challenging to find affordable housing.
Yes.
And the geography of it. That we are all the way out for most people coming the other direction to Greenport.
No, it's definitely a challenge.
Yeah.
And how can local residents take a more active role in their health and wellness?
I think for all of us, myself included, it's important to be active. We have such a beautiful community, getting outside, exercising, seeing the sun with sunscreen on, is very good. We have amazing food here with all the farms and the vegetables. And I think those two things, diet and exercise, make a big difference for your health. I think also making sure you get your regular preventative visits, that you have a doctor that you connect with or a provider that you connect with is important for health. Many of our community suffers with substance use disorders, and making sure that they feel safe to get help and know that help is available and recovery is possible. Psychiatric problems are a very large problem all over the country, and we provide some of the best care around. We have a wonderful inpatient unit to help patients, and we also are starting outpatient mental health at Quanticut in Riverhead. We have a clinic there for substance use disorder, and we'll be also providing mental health as well for children and school-age children as well.
Have you seen that over your time, even since COVID, a rise in mental health and substance abuse?
Absolutely. COVID was a difficult time for all of us. I think some of our kids, most especially, and access to care was a big problem too. Finding a therapist or a psychiatrist for a kid is so challenging.
Yes. And how do partnerships with organizations like Peconic Landing, the the local EMS and community groups improve healthcare access?
I think hearing about what their needs are, how we can do better, what we can bring to them is very important. I had the opportunity to speak at Peconic Landing, and they were very forthcoming with things that they'd like to see changes in. One of them, it kind of surprised me, but not really, was a lot of focus on the electronic medical record. And they were frustrated that it didn't communicate as well as it could have. We are going to be joining the same EMR, that's the electronic medical record, as Stony Brook in the next year or two. These things take quite a bit of time to build, but that's very exciting.
Yes.
And then really access to care is the other thing that they brought up. But all the different community organizations I'd love to meet with and hear about what they'd like to see at ELIH and how we can help them.
Yes. And I think Peconic Landing and the area has become more of a retirement community in a way, and we have seen a rise in providing that care to that community over time, and that population has grown.
Right. It is definitely an older population here in Greenport, Peconic Landing. I believe it's 450 residents there, and they range from independent living, it's like a country club, in parts, to memory care where people need really 24/7 directed care, and making sure that we're providing the best care possible to that population is important. We have a clinic that's at Peconic Landing, but services are growing in that clinic, and we're always looking at how can we add providers to that clinic to help that population.
And looking ahead, in your view, what does the hospital of the future look like for a community like ours?
I think making sure we're responsive to what the community needs, making sure we provide the best care that's appropriate to be delivered at a community hospital, and that we're partnered with a tertiary medical center. Stony Brook is the closest tertiary academic large medical center, and having such a good connection where we can, again, get someone there by helicopter or by ambulance, very seamless process to get patients in. That is what you need as a community hospital.
Yes, absolutely. And just also in your new position, what are you most excited about in your role at the hospital?
This community has been wonderful to me. I moved here 5 or 6 weeks ago. Everyone has been so friendly. It's a beautiful town, and I can't wait to help the people here get the care they need, and to work with the staff at the hospital. Just like that day when the power went out, everyone is still the same. They are so lovely. I see them interacting with patients, trying their best, and I'm really excited to help them and do whatever I can. Yes. And personally excited to get to know Greenport a bit better. I think I'll like it in the winter when it's quiet. I'm a homebody. I like libraries. I'll be down here checking out books.
Definitely.
Yeah, so I'm excited about that too.
Nice. And if you could share one message with the North Fork community about the Stony Brook Eastern Long Island Hospital, what would it be?
It's a very special hospital. People treat each other like family. They do their best. They take their jobs very seriously. We are here for you. Please share with me if there's things that you would like to see us do or that we could be doing better. Our goal is really to provide the best care we can for this community.
Absolutely. But I want to thank you so much for taking the time to come on the podcast today and share your story and your career and your new role here at the hospital here. So thank you so much for coming on.
Thank you for having me.
Well, I hope you enjoyed episode 195 with Dr. Alison Madden. I want to thank you for listening to the Floyd Memorial Library podcast, and we'll see you next time.